Dr. Peter Chin-Hong is a specialist in infectious diseases, and I asked for his opinion on the newest CDC guidelines.
An official statement that there is some, light, there is some ability to gather without masks is a welcome sign. Certainly it was bolder than some people thought with the mixture of vaccinated and unvaccinated in a small group. But again, overall, certainly a welcome statement.
So there's still no official green light on even domestic travel with spring break coming up and the concern about potential surges after a holiday situation like what we saw in December. Would you travel domestically right now? What would you advise your closest friends and family?
I would say that you weigh the risk and benefit of every travel plan that you make. Certainly, if you're going to see a sick relative and you need to travel, you're going to be less risky, certainly, if you've been vaccinated. But, if there are alternatives closer by, I still think it's probably a better idea until the dust settles. And the reason is really because, again, we're reopening at such different rates in the US. The weather is getting warmer. People are relaxing a little bit. And every single time we've done that in the past, we have this honeymoon period and we get a surge. Of course, we hope that we won't see as many ICU beds being used and hospitalizations, since most of the nursing home residents and those over 65 are increasingly being vaccinated.
Well, you mentioned different vaccination rates and infection rates around the world. So what does that mean for international travel? Could we really see vaccine passports in the future, or is there some other answer or another way to regulate who goes when, where, and what they need to bring? What do you see in the future there?
I think immunity passports or vaccine passports are inevitable. It's been done before with yellow fever and other vaccines. I think the issue right now is not everyone has equal access to a vaccine, so it's a little bit ethically fraught. But if people have exceptions to the vaccine passport, in other words, if you can't get a vaccine, you shouldn't not be allowed entry into certain areas just because you didn't have the opportunity.
What is your sense right now on the discussion of all these different variants that are now even moving and being found across different states in the United States? What is your concern there?
The concern is that as these variants, particularly the B.1.1.7 variant first described in the UK and others like that, if they are stickier, they're easier to transmit. With more people moving around, we may see an uptick in cases disproportionate to what we would have normally seen in previous times. We're worried not just about the variants we have right now, but the variants we don't know about. Every time we're not controlling the epidemic or the pandemic, there is a chance of a new variant that's going to be even worse than the ones we already know about.
So keeping the current vaccination rate in mind and the number of vaccines becoming available, what are some other challenges and concerns that we all should keep in mind?
So I think, again, not upending our progress. I think really a big issue for me is equity, and COVAX helping to fund some of the vaccines in the middle and lower income countries is essential. I think until we get that job done, we can't even rely or return to normal because the world's economy relies on open borders. And we can't have open borders, as you mentioned, without having everyone vaccinated.